Sacred work is working to make others happy and satisfied with their experience.
Having the opportunity to create friendships while at work.
Is learning how to listen to the heart of the patient.
Hello, my name is Sandy Johnson, and we want to take just a few moments to give you a sense of our organizational culture here at San Joaquin Community Hospital that we call Sacred Work. Sacred work is for us the expression of God's love in the work that we do every day, and it's experienced whenever need is met with love. The kind of love that chooses to deliver the highest standards of quality and service, all wrapped up in deep caring and compassion. Our staff put together a statement that says that sacred work is recognizing that no matter who you are and no matter what you're doing, whether you're waxing the floor or making an executive decision or changing a bed or giving a medication, that your work is sacred because your life and the life of the one you're serving is sacred, and we like that. To us, our work is not just a job, it's a calling, and it's an opportunity to bring healing and hope every day to the people that we care for. Since we created this intentional and very strategic shared vision for sacred work, being led by our CEO, Bob Beeler, San Joaquin Community Hospital is becoming a place of extraordinary growth and transformation. Let's listen in for just a few moments to what sacred work means to some of our leaders and our staff.
When I came to this hospital some years ago, the first question that Sandy Johnson and I, who was our chaplain at the time, would ask each other is, what is it we're doing at San Joaquin Community Hospital that makes it different enough from every other hospital to put Adventist Health on the side of the building? And I think the answer to that has been the focus on the culture of sacred work. Sacred work is the intentional strategy to change the culture in this hospital. Culture to reflect the compassion and the caring that's always been present in this hospital, but to really focus in on that as one of our core values. Sacred work has really made this a better place to be a patient, a better place to work, and a better place to be a physician, a better place to practice. It's also made this a place that other people want to be associated with. Some of the contracts that we have are here because the culture is different in this organization, and you can see it and you can feel it.
Healthcare is really fast-paced today, and it's so easy for people to get lost in the shuffle. And Sacred Work provides a format for us to support our staff emotionally and spiritually, for them to provide that most important interaction, and that's the interaction between caregiver and patient.
When I first became involved in the Sacred Works program, I saw it as being primarily for the caregivers, the nursing service here. I didn't really think that physicians would be that involved. Interestingly, in the last 2 months, I've had several physicians stop me in the hall, unsolicited, to tell me how special they think the Sacred Works program is to them, because they see that level of care and commitment by the staff.
It's not just one individual who has the responsibility for a large staff, but it's each of us not only being in tune with what's going on with us, but looking out for other individuals. And when we go up and ask, how are you doing? And they say, fine, we say, but how are you really doing? And give an invitation to talk, and maybe 2 or 3 get together and they learn from one another, they're strengthened by one another. And it's a community working together, not just one individual helping 50 people. It's everyone helping one another and being concerned and seeing our work as a team.
Once I was reviewing some video footage from one of our camera systems in the ER, and a patient had been discharged, and she was still very sick. We had her in a wheelchair. This was like 3 o'clock in the morning. The security officer that was on duty there, he went and got a blanket, wrapped it around her to keep her warm. It was in the winter.
And he went and sat down, and a few minutes later he got up and he got her a glass of water, and he actually fed her the water because she was too ill to take the cup herself. To me, that's sacred work.
I would describe the sacred work that we provide here as very caring, nurturing, and it's from the heart. You know, it's something that's true. The other day I was working with a patient, and after I gave them their breathing medication, they asked if they could talk to me, and they had some spiritual questions that I was able to sit down and talk to them about, you know, and through sacred work, that gives me the freedom and the ability to not only meet the patient's needs medically, but to sit down and meet their spiritual and emotional needs. And that's something that I've only found here at San Joaquin Hospital.
In our office, there's a group of ladies who have come together, and they have an appreciation committee. And each month they appreciate someone in the office who's gone the extra mile. And they have a potluck for them, or they just, you know, do something for them to make them feel special. And I think that that is a great example of sacred work, to go out of your way and make someone feel valued and appreciated.